In this video, we will be talking or discussing the arterial supply to the head. The arterial supply is going to start with a common carotid artery. And one of the first branches off that common carotid that comes over to the thyroid gland will be called the cranial thyroid artery. The common carotid will continue up. Here we see another nice arterial branch, the cranial laryngeal artery, coming with the cranial laryngeal nerve. What we are looking for now is the internal carotid artery, which should come off of the common carotid, and we can usually distinguish it by this little bump called the carotid sinus. There is another vessel that comes off very close to the internal carotid called the occipital artery. So the two of those tend to come off very close together. We name the internal carotid due to that carotid sinus. As soon as the internal carotid comes off, then the main channel changes to external carotid. From the external carotid, we are looking for a number of different vessels. One of them is the lingual artery, okay, that's going to come under the tongue, that runs with the hypoglossal nerve. In this particular cadaver, this large branch, which arises from the external carotid coming up to the caudal aspect of the ear, is called the caudal auricular nerve. That external carotid will continue on. We will follow these vessels from the on another specimen in just a minute. Notice that this digastricus muscle is in our way. If we took the digastricus or a piece of that off, we would be able to see that external carotid much easier. One of the terminal branches of the external carotid that we can still see, however, in this cadaver is this branch, the superficial temporal. And that is the name change from when our main channel changes from external carotid to maxillary. I'm going to take this head briefly and turn it so from the lateral to the medial aspect. And we're going to do some of what we just did, but I'm going to show you how we can see it from the medial point of view. So, once again, out here we have our common carotid artery, our cranial thyroid. We come up, and from this perspective now you can really see the internal carotid and the occipital and how the two come off very close together, and this little bump here with the carotid sinus. The external carotid, once that internal carotid comes off, that's external carotid. We saw the craniolaryngeo from the other side. We're still external carotid, and we're looking at that branch of the lingual going with this big hypoglossal nerve, which will cover in cranial nerves, and then again external carotid coming up. So now I'm going to take you on a different head and continue from the places that we just talked about. So let's start back again at that common carotid in this particular cadaver, and we'll take it from all the way that we can follow. Once again, common carotid artery here, beautiful thyroid gland here, making this the cranial thyroid artery. That common carotid will come up. We are wanting to look for that internal carotid here and the occipital here. In this particular specimen, it appears to have 2 occipital arteries, which is fine, and maybe even 3. Don't know. Anyway, the internal carotid was this first one. That makes this continuation external carotid. From that external carotid, we're going to be looking for a branch, the lingual, running with the hypoglossal nerve. We're also looking for this branch, the facial, which comes all the way up to the face, which we've taken off a number or a big chunk of that musculature. This branch here, again, similar to the other cadaver we looked at, is coming to the caudal aspect of the ear. That external carotid, after that caudal auricular comes off, tends to usually run up and over in this direction. In this particular cadaver, it decided to go underneath the jaw. But nevertheless, it sort of took a little bit of a stranger detour. It came up and around in this direction. This branch here was the superficial temporal, which would have been going up to the temporalis muscle, which we have removed. From there, that maxillary artery, then it becomes maxillary, and that maxillary artery is going to cruise through that alar canal and come out and just continue to be the maxillary artery. The maxillary artery, I'm going to rotate this really briefly. I believe you can see this inside this little hole. You can see that, good job. Maxillary artery goes straight, and see this little piece right here? Descending palatine, which will give off a number of different branches that you do not need to identify specifically from here. Maxillary will come through, come out the infraorbital, foramen as the infraorbital arteries and nerves. So that should conclude the tour of the arteries to the head.